All right. Thank you, everyone. Thank you for joining us. This is the Maine EMS. This is not the board meeting, by the way. Sorry about that. This is the biweekly COVID-19 update for March 18th, 2021. Just some ground rules for everyone. Everyone that enters the meeting is muted. We ask that you leave your video off to help us save a little bit on the bandwidth. If you do have questions, please put your questions in the chat. If you don't have the ability to put questions in the chat, we have the ability for you to send us a text message. That number is 207 370 2072, 207 370 2072. This meeting is being recorded. I clicked too fast. And we're going to post it later on the Maine EMS YouTube channel. If you haven't done so already, check it out. We hit 100 subscribers, so we have our own personal YouTube channel right now. Looks really, really cool. And hit the subscribe button and the notifications button, and every time we post new content, you'll get notified of it, which is cool. And so without further ado, I'll send it over to Director Hurley.
Good afternoon, everyone, and thank you again for joining us this afternoon as we continue to progress through this ongoing COVID-19 pandemic and our response, our statewide response. As always, I would like to thank you for everything that you and your team are doing on a daily basis to support the ongoing response and the toll that takes on each and every one of you is important to acknowledge and to make sure that people understand and convey and share the resources that are available to help support each and every one of you. So those regional resources are the peer support groups, the CISM teams. There's also the Maine Frontline, Warm Line, and then as well as other national resources that are available to you. Please don't hesitate to encourage people to go to the Stay Healthy and EMS page on the Maine EMS website for all resources that we have aggregated. There certainly are more resources out there than what we have, but for all of the ones that we have aggregated, you can find contact information and information on how to utilize those resources on our website. Just very important that we continue to encourage people to utilize those as we are really starting to understand the implications of this on mental health of the lay person, much less the mental health of the first responder or healthcare worker. So please keep that in mind. Please note that mental health is kind of like if someone broke a leg at work, you would make sure that they got treated to have their leg treated. If someone has some mental health concerns at work, we should really work to make sure that they get their mental health concerns addressed as well. So I did steal that example from Jason, so kudos to Jason. But that is something that we really need to prioritize. So just making sure I continue to iterate that every time we have a conversation is important to me. Next. So I think it's important for me to kind of hit on vaccination efforts and what's going on in the vaccination world right now. Most of the vaccinating agencies in the state of Maine are working diligently with what little supply they have, but we have not received allocations this week, and we will not receive an allocation for next week. And so a lot of them are at idle right this moment, or doing what little doses they have available that like either second dose clinics, or if they have some doses squirreled away for first doses that they haven't administered yet, they are working to administer those this week. But we did not receive additional allocation for next week. However, we are told by Operation Warp Speed federally that we will have a significantly higher allocation that first weekend in April or so. So we anticipate that the week after next, we likely will have significantly more vaccinations, and that those agencies that are interested in continuing to vaccinate will have a significantly, will have doses to use. And so we know that that is extremely problematic for agencies that are planning vaccination efforts when you have no idea if you're going to get anything or not next week. But we are working to get that information to you as quickly as possible. But I do want to make sure people understand that the doses and the allocations doses are not the local EMS agency just deciding they don't want to vaccinate people. They're not actually getting doses to vaccinate people with. So it's important to keep that in mind. For those individuals in the 1A category, so first responders, fire, police, EMS, and dispatch, there have been some that did not want to receive the mRNA vaccine. So they didn't want the Moderna or Pfizer, but they are potentially interested in the adenovirus or the Johnson & Johnson Janssen vaccination. If that is the case, it is important to note that they are still prioritized. However, there isn't necessarily a mechanism for them to sign up somewhere to get vaccinated and choose which vaccine they're going to get. So that would be something that they would need to coordinate. EMS agencies that are providing vaccinations can certainly bring those persons in for vaccination and prioritize them. But, again, they may or may not have the Johnson & Johnson vaccine available at that time. So that would be some local coordination, and it would likely require that the individual recipient of the vaccine travel to figure out where they can get the vaccine that they would like. We don't have the capacity to send single doses or to send just a couple of doses here and there to make sure that we, accommodate their whim. They would need to seek that out on their own. So those resources are available. The vaccinating agencies in each county can help coordinate where there is a vaccination site. But again, that's the responsibility of the individual at this point. Those EMS agencies have literally bent over backwards to make sure people got vaccinated. And if they elected not to get vaccinated at that time, that was their decision. And they are still prioritized, but the reality is that it's not the responsibility of the vaccinating agencies to chase them down either. So just want to make sure we put that out there so people are aware of that. Question that Steve Leach put in the chat: do you expect that larger allotment in early April to be J&J or Moderna? That larger allotment supposedly is supposed to be J&J, which would be a significant aid to many of the EMS agencies in scheduling and other processes if it's just a one-dose series. And so we are told that it will likely be J&J, but we should be prepared for Moderna because you never know with these folks. But we are told J&J. I believe, for those vaccinating agencies that are continuing, please note that reimbursement for the vaccine has changed. As of the 15th, the Biden administration has directed CMS to increase the average reimbursement rate from the $45 total to $80 total. And so $40 for the first dose and $40 for the second dose on 2-dose series, and $40 for the single dose. That may change your models because you would be making significantly more money, almost double but it is not retrospective, so it doesn't look back before the 15th of March. But any vaccinations administered after the 15th of March, I believe Jason and Darren have actually already changed the coding in our system so that it bills or codes for a $40 charge for each of those. So just letting you know, I know that there are EMS agencies in the state looking to get into the game. We just want to make sure that we share that information with you. I don't know what happened to Jason's screen, but I do know what the topic is. So PPE vigilance is the next thing I'd like to talk about. Please note that vaccination does not mean that you don't need to wear masks, that you don't need to take any of those actions to protect yourselves. That is not what that means. And Maine EMS did circulate guidance recently stating that the guidance from the US CDC is intended for the general population and not for EMS clinicians or other public safety entities that we regulate, like EMD centers. So please take note of that memo. I think I've answered most of the questions that I received via email about that memo, which was just 2. And that was about EMD centers, whether or not that applied to EMD centers. But please note that Maine EMS is still directing organizations to wear masks in shared spaces. And that is very important. There has been a question that people have asked us to clarify. Maine EMS is fine if organizations allow their members to wear face coverings, so cloth masks, in the station or in the department when they're, not on a call. When they're on a call, they should be wearing medical grade masks. So they should be wearing either a surgical mask or an N95 when they're on a call. But if they are in the station just lounging or, doing other station duties, they can wear a cloth mask. That is fine. I think there was some confusion about that. It is important that they keep those cloth masks clean. We don't want someone wearing a cloth mask for, 80 days in a row. First off, that gets a little gross. But it is important that they wash them if they're going to use them. But just letting people know that it is okay for you to wear a cloth mask when you are not performing your duties. But the moment you are performing your duties, as far as healthcare duties, you should be wearing a surgical mask or an N95 as indicated. So just wanted to make sure I clarify that for a couple of people. Okay. I'm excited that the QA/QI committee, as well as members of the Maine EMS staff, were able to put together another great QA/QI newsletter. This time it's about behavioral health. When we talk about mental health for EMS clinicians, it's also equally important for us to talk about managing behavioral health emergencies in our everyday clinical practice. And so this newsletter really highlights some concerns and some quality assurance issues that we think services should look at when it comes to the quality of our management of behavioral health patients and behavioral health emergencies in the state of Maine. I will tell you that the numbers look unimpressive, to be candid with you, and kind of disappointing. But I think a lot of that is documentation. But I think sharing this newsletter and making sure people see this and see their data in action, and seeing information come out of their data is very important to justifying why it's so important to have good documentation. For instance, the number of people who document a blood sugar in the case of someone with a behavioral health emergency is, less than 30%, I believe, if I remember correctly. And, is that truly accurate, or are they doing it and not documenting it? And so that's really important that we share these types of newsletters and these things with the community of EMS clinicians to say, hey, your data is important and what you put in that chart is important. And so I say this because that same message is equally important when we're talking about PPE and when we're talking about those types of documentation issues, because we send out those notification emails. I know you get those emails on a daily basis. Some of you, you're probably tired of getting them, but it's so important that we continue to emphasize the nature of documentation and what high quality documentation means in the Maine EMS system. So I'm not going to ramble on about that any longer, but please note that the behavioral newsletter is available on our website, and we hope that you will share it. I will turn it over to Dr. Shaw. I know that he has somewhere to go in a few minutes, but I will turn it over to Dr. Shaw.
Thanks, Sam. Can you hear me?
I can.
Thanks, everyone, for attending. And I echo Sam's appreciation for all the hard work that folks continue to demonstrate during this pandemic and your ongoing attention to this topic matter. From an MDPB standpoint, the group has been continuing to meet on the second and fourth Mondays of every month. Our focus has most recently really been on the vaccine campaign, and we want to really share our tremendous appreciation for all of the EMS agencies and EMS clinicians who have contributed to vaccinating the near 20,000 doses of vaccine provided through our system to public safety, and now moving on to the governor's next tiers of folks. That effort is tremendous, and we can't thank you all enough for participating in that regard. We also have been talking about the need and urgency to maintain our current protective posture, and similar to Sam's message, we recognize that there might be a time in which regular society begins to unwind their protective posture, such as what the CDC released 2 weeks ago. But as a healthcare entity, we will probably be last in that regard to undo our protections. And that's so particularly important since we are the caregivers to our society's most sick, injured, ill, etc. And we really need to maintain our protection to protect our patients. And so please know that we are deliberating about this regularly as an MDPB with Sam, Maine EMS staff, and amongst the Maine EMS as a whole. And we will do our best to keep an ear to the ground and understand when it is time for us to adjust our posture. But right now, as Sam mentioned, is not the correct time. So we are excited to see the efforts of our vaccine campaigns, both through the EMS system and at the national and state level as a whole, and excited to find that time, but it is not at this very moment. Those have been the major topics at the level of the MDPB. We have been tracking also the expected release of new vaccines. Certainly the Johnson & Johnson or the Jensen product was the one we expected next. We'll have to see what the landscape for vaccines looks like moving forward. There have been a couple different hiccups in that regard at the international level that have perhaps changed what it might look like in the immediate future, but we continue to watch that closely, and we'll keep everyone updated as we learn more regarding that. Otherwise, I don't think there's anything new from the MDPB, but please use the chat function or the text function and reach out to us if you have a question now, or offline through email, which is all of our emails are listed on the website if any questions come up between now and then. Again, thanks to everyone. Please take care of yourselves and each other. This has persisted for a long time, and we continue to exist under the conditions of the pandemic right now too. So please reach out and watch out for each other. Thank you.
So now I'll really open it up for questions if anyone has those. As always, please feel free to put those in the chat or send us a text. Yeah, we will just hang out for a few minutes and see if there's any questions that we can answer for anyone.
Sam, we don't have anything in the chat right now, just so you know.
Perfect, thank you. And no text messages?
No text messages.
I feel like I have fear of missing out. Someone's not messaging us.
I think it's just you did such a good job explaining everything to them. Oop, there we go.
Okay, we have booster vaccinations pending for 324 and 43. Any word of getting vaccinations for this? So if you gave the initial dose, your booster vaccination should be shipped as they've always been shipped. That should not affect, none of these allocations affect booster doses. If you receive those initial doses as a result of a transfer, you will need to reach out to the originating transferring organization to get the doses from that organization. But booster doses are not affected by this, or should not be affected by us not receiving additional allocation, because that's not how the booster doses are ordered. And Steve, we do still recommend actively monitoring with daily temperatures. We can still have people who are symptomatic. We know that not every EMS clinician is vaccinated, and we know that it still is possible to contract COVID despite being vaccinated. So it still is important to monitor temperatures daily. Next question, I haven't heard anything more about the extension of the Buy Next Now expiration dates. Jason, did we send out that list?
We sent out the operational. I think we created an operational bulletin about it and sent that out to the service leadership.
Okay. Sorry, I'm trying to pull up the list. Okay, we can get you a copy of that list. Download it right now. But there were only some specific lot numbers that were exempted, because to have an extension to your Buy Next Now expiration dates, that has to be explicitly approved by the US FDA, and so they approved a specific group of lot numbers. And I'm going to put that file in the chat. One moment. Okay, so you should be able to open up that PDF that's now in the chat. That has a list of all of the lot numbers and the new expiration dates for those lot numbers. Most of them received a 3-month addition to the expiration date, but it is imperative that you check to make sure your lot number has been given an extension. Once you're in like a month range of the expiration date, we will be giving out guidance about how to transfer them to a higher throughput organization that will use them more quickly. And then we can backfill you with additional tests as needed. But you can't just put them in a trash can, is the moral to this story. They are considered medical waste, so they would need to go in a medical waste basket. They can't just go in the trash. If you do end up throwing some away, they shouldn't be going in the trash. And used ones should be going in sharps containers, because they are considered a biohazard. If someone is symptomatic, essentially positive, you may have literally COVID on a swab there. So that should be going in a biohazard container. Okay. If you have any additional questions about the Binax, please don't hesitate to reach out to the office. We'll be more than happy to answer any of those questions you may have as well. We will also make sure that people have the operational bulletin. Jason, I'm questioning whether we sent it or if we just drafted it and didn't send it. If not, we will make sure we send that out about what to do next and how to transfer those kits. But it looks as though all of the major lot numbers in the state of Maine were given a 3-month extension. So it will not be necessarily a major issue until we get into May. Well, we'll make the transfers in April, so I guess next month. Okay, well, rather than hear me ramble on, again, Maine EMS is always available to answer any questions or concerns that you may have. Please do not hesitate to reach out to our office via email at maine.ems@maine.gov or via phone at 207-626-3860. That's 207-626-3860. We'll be more than happy to answer any questions that we can. Email is likely the best way to get us. Literally, if you send an email to that email address, it goes to everyone in the office to work on. So usually that's the quickest way to get a response from at least one of us. As far as viewing this recording, what will happen is Jason will wait until the video is processed by Zoom, and then he will upload it onto our YouTube channel. And so it will be available via YouTube for review, and no problem at all. And it will likely be available first thing tomorrow. Jason, don't you think it should be available by then?
It'll be available by the end of the day.
Okay. And we have to wait until it's processed so that we can get the transcription so that we meet all the ADA requirements about having transcription and closed captioning with our recordings. So that's why we have to wait a little bit. Okay, does anybody have any additional questions, comments, or concerns? Thank you so much, everyone, and I hope everyone has a great day. Thank you.